So around 400 people have now caught the Delta virus in this Sydney outbreak over the past month or so. 40 of those are in hospital, 11 of those in intensive care. One of the 360 or so not in hospital is Josie Bryce-Smith, and she joins us now from Sydney. Josie, welcome. Thanks so much for talking to us. First off, and most importantly, how are you holding up?
Thank you for having me. Yes, I'm fine. I think that my symptoms are relatively mild compared to people who are obviously in hospital. So I'm feeling, quite lucky. But yeah, I'm still, it's sort of like I've got a bad flu, would be how I could best describe it.
And is it like coughs and headaches?
Yeah, so I've got a really bad headache now. I've got a lot of body aches. In fact, that was my first sign, particularly around my jaw and my legs aching. And I've got a very bad chesty cough. My throat is incredibly sore and swollen, and you can see that all my glands are up all around here. So, and I completely lost my sense of taste and smell. So I still think my symptoms are reasonably mild, but yeah, it's definitely not pleasant. And there's a massive shortness of breath. And even for me, and I'm a very fit person, deciding to go upstairs or come downstairs, I sort of need to think about it because you're exhausted when you get to the other end.
And in these situations where someone's got the virus, but is sick, what's the contact with medical professionals to monitor your condition?
Yeah, so New South Wales Health ring us multiple times a day. And in fact, St Vincent's Hospital dropped this off, which is a monitor that I have to put on my finger twice a day that reads my oxygen level and my pulse. And then we also have to take our temperature, and there's a coronavirus app now, because we're actually part of a study, because they are studying, what happens to us. So we have to fill this app in twice a day. And if we don't fill it out, they ring us within about 10 minutes and ask if
Wow.
we're okay. If you don't have enough oxygen, they take you straight to hospital. Like, there's a lot of vigilance around what they do.
And so how are you feeling about that process where they're monitoring your condition? You're not having direct contact with medical professionals, but you're sending them this information. How are you feeling about that process?
Yeah, I think that they're really onto it. The Children's Hospital ring my daughter, who's been very sick. She had a high fever for 5 days. She thought that she was freezing, but she was actually absolutely boiling. So I've been in the house with her for 2 weeks. Yeah, there's been a lot of support. I suppose I just think that people don't realise how quickly it spreads. We were in what they call the Bondi cluster, and I know at least 15 people that it has spread to, and with another 2 last night, all within the households. Everyone's being safe, but we see what's happening on the news and that people are out there. And when I went for 2 tests at Bondi Beach, particularly on Sunday, people were on the streets drinking with no mask on, and they don't understand that airborne is number one. New South Wales Health told me my biggest chance of getting it off my daughter, who got it first, was via the air, and that hard surfaces are second. So, for instance, if she gets out before me, which is likely, she can't pass it to anyone through her clothes. But for instance, if she took a carrier bag from a supermarket, anything plastic, it can carry it for 24 hours. So people are touching cups and being near each other. Like, if it was me knowing then what I know now, I'd be wearing a mask, I'd be wearing gloves in a supermarket, and I'll be staying home. Just follow the rules. I mean, we didn't break any rules. My daughter caught it before the lockdown at a relative's house at a dinner. So it was very unlucky. But it's very frustrating when you think people think it won't happen to them, but trust me, it can happen to anyone. And I just think that people should follow the rules and get vaccinated.
And Josie, when did you find out that you were positive, and what was your reaction?
Well, to be honest, when we knew that my daughter was a close contact, we immediately went into what they call close contact isolation. And so then she developed it, started getting symptoms a couple of days later, and then got a positive test 4 days later. And then I got symptoms and got a positive test another 4 days later. So I wasn't surprised. I also wasn't scared because I believe I'm a reasonably healthy person, but I still, I still didn't think it was going to happen to us. I was most shocked when I found out she was a close contact.
And you mentioned that she's been through a pretty rough time with this. Was there any stage? Has there been any stage where you thought she might have to be hospitalised?
Yeah, certainly there was at the beginning, particularly in the first couple of days. Her temperatures were so high, and the Panadol did not bring them down enough. And I was, very confused at that stage about whether I should be in the room with her trying to help her, because they told me just to leave the food at her door. New South Wales Health did talk me through that, but eventually I used a combination of Nurofen and Panadol, managed to get her fever under control. But if it had gone any longer, they certainly would have taken her into a hospital.
And how are you feeling about your condition and what you know about the progress of what happens with the infection?
Well, I just know now how fast it spreads, and I'm very wary about it. And obviously, I'm immune from the Delta strain now, but there are other strains, and I just think that people need to realise that it's airborne. So, for instance, if I get a delivery from Woolworths or whoever, if I go to the door without a mask, my air for 10 minutes is contaminated, just the air around my door. So if I answer the door, I generally don't. I just shout to them, leave it at the door, but I wear a mask. And the delivery drivers stand right back because they obviously know as well that it's airborne. So I think even if I was walking in the park now, when I get out, I'll be wearing a mask and I'll be staying away from other people. Social distancing is really important. And I just don't think that people understand. And I probably didn't understand, to be fair, until I got it and saw how quickly it's spread within the people that have got it. And 2 people that we know are in intensive care on respirators. They are more elderly, but a lot more young people are getting it now. 2 young people we know got it last night, again within the house. And in a way, New South Wales Health say it's better to get it, because if you don't get it and you're in a house, you then have to isolate for another 14 days after the last person has finished. Because people are getting it that are close contact. They're getting it on day 12. So I got it on day 5, but my son and my partner are isolating at his house, and they're regarded as a close contact. They've had 3 negative COVID tests, so it's highly unlikely they won't get it. But New South Wales Health told me they have to isolate the full 14 days because they have had people get it on day 12. So it's a very clever virus. It can hang around and you can get it much further down the line than you come into contact with somebody than you think.
And Josie, how are you feeling about your condition? Do you feel like you'll get better from here, or what stage are you at with your infection?
So I'm at day 6. So they say between day 5 and 8 is the worst. I definitely feel better today than I did yesterday. The worst thing that I've got is a very bad cough. But I can feel that I'm on the mend, but I'm also taking a lot of vitamin C, zinc. I look after myself, well. I've always been healthy. So I think that I'm going to continue to get better, but I'm taking it very easy, which is something that I never really did before. I always worked quite hard, but I'm taking it easy because I want to recover from it as soon as possible. So I feel incredibly lucky, and I feel that I have a mild case of it. My concern is that I just don't want to spread it to more people. So obviously I'll be following all of the guidelines, and I'll be getting vaccinated. And I think that people should be responsible to each other and not spread it, because it's dreadful.
And what has been your opinion on vaccinations? And before this arose, were you able to get access to a vaccination earlier and decided not to? Just talk us through that.
So no, I'm 46, and so I was eligible for the Pfizer, and I'd had an appointment. It was actually coming up next week, so I had always been keen to get it, and I was just in the waiting list. So I definitely think that people should get vaccinated. I can't understand why people wouldn't, because there's just so much risk with it spreading, and it's obviously doing so much damage to people's lives and business. And yeah, I just think it makes sense. So I will certainly be getting vaccinated.
And I don't know if you're in a position to talk about this or not. If you don't want to, don't. But you mentioned know some people in ICU. Is it the case that even some of those people in ICU had been vaccinated or not?
No, as far as I know, I actually don't know the answer to that question.
Right. Okay.
Yeah.
So
Sorry.
what's thanks so much for talking to us about your condition, because this is the first time we've heard directly from someone who's caught this virus in this latest outbreak, and it's really striking to hear from you and see what effect this has on you and your family. And so I think it's really important that we hear these messages. What is your message to those millions of people out there now in Sydney who are subject to this lockdown and who are possibly susceptible over the coming weeks to this virus, because this outbreak has continued to grow? And yesterday we had the biggest number of new cases, and a significant portion of them were people who'd been out in the community while infectious. So at this critical point, and for someone coming from someone who is ill, what is your message to people?
Yeah, I would just say stay home, follow the guidelines. They know what they're doing. Like, Gladys would be getting a lot of information. And I look at her now on the news and I think they know so much more than they tell us. And that's okay. They need to. But just stay home, wear a mask if you go out, get delivery wherever you can. Don't mix within houses, even in family, because that's no safer. Just because you're related doesn't mean that somebody couldn't get it from a public place. I just think, be responsible and stay home and look after yourself and look after your family, and don't think that it couldn't happen to you, because it could happen to you, and it could be much worse for you than it is for me, and I don't want that for anyone.
And what about getting vaccinated?
Yeah, and I think get vaccinated. I really do. I just think, and I see that they are massively increasing the amount of doses that are coming into the country, and get vaccinated so that we can all get through this, and it doesn't get any worse. The last thing we want is more people to die and for it to spread more and for us to be in lockdown for longer. So I'm going to be getting vaccinated, and I would advise that people do the same.
Yeah, okay, Josie Bryce-Smith in Sydney, thanks so much for talking to us. It's really important we hear from people like you, so we really appreciate you having a chat to us this morning.
Thank you.